Acid reflux is a very difficult problem in this population because, again, it's a symptom that we look for obvious features. If a child can complain that I have heartburn, or a child can say I'm having stomach pain in the upper part of my abdomen, we know to look for that condition. But again, children with autism won't often present that way. Hi, you guys. How are you?
We're good. Back. Yeah. You want to? Can you say hi to Dr. Buie? Go ahead. You did it.
Hi.
Yeah. Thank you.
Thank
That's
you.
better.
Come on back here. And they will very rarely present with things like spitting up or regurgitation. Those are problems that we see in much younger children who have acid reflux symptoms. Children with autism will do other things to suggest that they've got acid reflux. They will constantly want something in their mouth, and they'll be constantly chewing on something, or they'll have their hand constantly in the mouth. They may have pica, where they're seeking non-food-based products to put in their mouth, etc. Children with autism do things like point to the area that they've got pain, but not actually point to it, because pointing is a very difficult thing in children who have autism, and we're trying to teach them that skill. But so they will sit and they'll tap, or they'll point to areas that they might be having trouble. Some kids with dental issues will literally be saying, please look here, and they'll be doing it in a tapping way, so you think it's a repetitive behavior. You've been taught that that's a repetitive behavior of autism, but it's actually them saying, please look, please look. And they'll do it on their chest very frequently with kids who have autism, or they'll really try to be pointing to you. Other things that those children will do is they'll chew on their shirts. They'll be constantly nibbling on something, and I've got kids who walk in the office who the front of their shirt is absolutely destroyed. I know what that child has before I do an investigation very frequently. Rebecca is a wonderful example of a gastrointestinal issue that wasn't clearly gastrointestinal to her medical providers. She was seen, she was having an enormous amount of distress, she was flopping on the bed, she didn't want to go to bed, she was really quite miserable. She became aggressive, she was self-injurious, and the family said this is a change for her. She has changed. This is not her autism. This is not an autism behavior. We're very worried about this being a medical issue. And her medical provider said, we couldn't possibly evaluate her. We couldn't possibly put her to sleep to investigate the possibility whether this could be acid reflux or some other underlying medical issue. We're going to treat this as behavior. And that's when the family picked up and moved and went and found another provider.
Right now in the bathroom, when I knew she needed Tums again, she's like going like this. So, but it's like we know that old kind of way of thinking. So we're concerned that there is a flare up of the gastritis at this point.
She had severe erosive esophagitis related to chronic acid reflux. And even before we'd done the endoscopy to show that, we had tried antacid medicines, and we really didn't seem to settle her symptoms down. So one could make the conclusion that if you treat for acid reflux and the child doesn't get better, that the problem isn't reflux. That may not always be correct. Okay, so all I'm going to do, I'm just going to press on your tummy, and then I'm going to... Almost done. You're doing great. And sometimes we try things and we are not so clear that there's been a benefit. That doesn't mean the problem isn't there. Sometimes a medical investigation is really necessary to get to a clear-cut understanding and to decide that you need to stay home, that the thing I tried didn't fix that problem, but this is the problem, or this is at least a problem in those behaviors. Often children with reflux or other abdominal pain will seek pressure in the area that they're having distress. So they'll be the child who's leaning over the furniture, constantly trying to get input pressure. And again, that's been taught to us as a sensory process, that these kids are seeking input from a sensory point of view, and it might be, but they're also often pointing to an area that you should be specifically looking at to account for that problem.